a little bit about me. So I graduated from Medical University Vlere in 2021. I am currently working as an F3, so this is my third year out of training in critical care ITU, Croydon University Hospital. And my interests are anesthetics and general medicine, but I'm sort of hoping to apply to anesthetics this year to start next year in August. So I think we all, when we finish med school as an international medical graduate, we sort of feel a little bit overwhelmed thinking, how do we get into the NHS? What's the next step? There are different routes, as you can see here. So there's trust grade post, locuming, the FT standalone, and actually applying for the UK Foundation Programme. So I'll sort of briefly be speaking about each one. So trust grade is the most common route into the NHS as an international medical graduate. This is the way I applied and most of my friends applied. So trust doctors are essentially employed directly through the trust rather than through Health Education England. They're for doctors who are not currently part of the training program, which is most of us as medical graduates. The jobs range from different grades. So you have FY1 as well, but mostly FY2, CT, ST, 1, 2, and they're fixed terms. So they can be 4 months, 6 months posts, 1 year posts, or even 2 year posts. You apply for these jobs through the NHS jobs or track jobs website, where you will find the job description and person specification, closing date, and salary. So when you apply for trust grade jobs, you will essentially make your application on the track jobs NHS jobs website. You'll put your name, GMC. By this point, hopefully you've got a full GMC license if you've done 6 years as a med school. Then it'll ask you about management skills, leadership skills, any teaching experience, and at the end you have the supporting information. And essentially, the information you put in the supporting information is essentially a way for you to show off and tell them everything about you and tailor it to the person's specification. So tell them, I know when we finish med school, we get a little bit, we feel like we haven't done enough, but even things like, so leadership skills would be, have you been a president of a society? Have you taught, for teaching experience, have you taught a group of students in the lower years? That's sort of evidence for these skills. So it's very important in the supporting information to show off and tell them why they should choose you over someone else. Because you will be competing with a lot of international medical graduates for that same role, and you want to show them why they should pick you. So if you're shortlisted, then you will be called for an interview, and if you're successful, you get the job. So that's trust grade, and this is essentially the most common route. Most of my friends and that I know apply through this way. Locuming is another way to work in the NHS. Locum doctors essentially they temporarily fill vacancies in a hospital. So any rota gap in a specialty, if someone's sick or they're off for whatever reason, they will put out a locum job for that day, whether it's an on-call day, night, or a normal working day, and someone will fill that role. A locum contract is usually undertaken on a short-term basis, but can also be long-term. And there are two paths. There's locum agencies for doctors, and one example is Holt Doctors. I've personally never signed up with locum agencies, but the second one, which is essentially jobs by the internal NHS bank, I have worked on a locum shift on through my trust. So I've worked at Croydon as a locum when I've just needed extra cash. So the advantages with locuming is that it allows you time flexibility, so you can work around commitments. It gives you financial flexibility. So if you want extra money, you can, locum shift gives you that. Also location flexibility. So if you want to work in an area that you enjoy rather than sort of, applying for a job and having to move away, locuming is the way, and also high rates of pay. There are some cons, I feel, with locuming. I guess there is uncertainty. There's no guarantee that you will get as much work as you had hoped. and subsequently there's that financial instability where you won't get, your monthly salary. It will depend on how much you have worked in that month. Um, and I think it can be difficult if you're working in different wards. You might not feel like you're part of a team and you haven't sort of formed that relationship with other doctors, nurses, other colleagues. And at times, especially if you start as a locum, once you graduate, it can be a bit daunting because it can come with high expectations as opposed to working as a trust grade because you are filling in a rota gap. So they sort of expect you to get on with it. Um, I I think Dr. Pretty might, if you have questions at the end about locuming, she might be the best person to ask about this. Um, but yeah, essentially this is another way of working in the NHS. So I think you have to think, is this the style of work? And is this style of work right for you? Um, Personally, I didn't want to apply as locuming at the start, but I have locumed at my trust for extra money. So the FU standalone is an open spot and foundation program. So it's designed to provide a route of entry to training in the UK for doctors who graduate overseas with a full GMC registration. So that's those of you who have done 6 years of medical school and you've done your final year was your internship year. You're eligible to apply for FU standalone. Um, it is a training post that is available to be applied for January via Oriel. Then the post starts in August of that year. The requirements are that you must have passed IELTS or OET by the time you apply with the required score. Or if you've worked as an F1 and you want to apply for F2 standalone, you can, or if you've worked, I assume if you've worked in the NHS, I guess as a healthcare assistant or something else, you can get a consultant to provide a testimony to say that your level of English proficiency is adequate to continue. I did apply to the FD standalone. So I applied via Oriel. So this is sort of an overview of the process. So you apply to FD standalone vacancy on Oriel, and then you get longlisted. You sit the situational judgment test, and this is essentially a sort of test that presents you with realistic hypothetical scenarios and asks you to identify the most appropriate response and rank them in order of the most effective answer. So it's something that you can't really study for, but there are sort of questions to help you, booklets, questions to help you sort of prepare for that exam. And then if you score a high enough score, you will attend an interview, 20-minute interview, and then you can put your preferences of where you would want to work, train for your F2. I actually did apply for the FD standalone. Was longlisted. I sat the situational judgment test, scored really, really very highly, but unfortunately, my interview was after my night shift, so I had a very brain fart moment and didn't pass the interview. So you can, I think you have to sort of think about even if you do get to the interview stage, you have to. Unfortunately, I wasn't able to move the interview to do it at a later date, but you just have to keep that in mind that it can, work can affect your interview, and it did for me at that case. And sorry, can you see me moving the Can you just see the screen?
I can see your slides and they're moving.
Am I moving it?
So currently you're on UKFP, is that the right slide?
Yes. Okay. Sorry, because I can see the camera, and I'm just moving it around because I can't see the titles. So I'm just asking if you can see if I'm moving around, or you can just see the slides. Does that make sense?
I think so. So I can see it as a full screen now.
And that's all you can see, right?
Yeah. And I can
not
see
like me moving the Zoom,
No.
Okay, fine. Sorry, I've been moving it so I
fine.
could see the titles, and I don't want to be annoying to you guys. Okay, fine.
No, that's fine.
So the UK Foundation Programme, so if you have, so this is for medical students who have 5 years of training and they haven't done an internship year at their medical school. This is essentially what the UK doctors are part of the foundation program. It is a 2-year work-based training program that exists to prepare junior doctors for specialty training. If you've completed an internship year, so 6 years, then you're eligible for full GMC registration, and so you're not eligible for this program. You could apply for F2. F2 standalone, but this is for those who have not completed an internship year. The national application process for the UK Foundation Programme starts around October. However, the eligibility criteria starts around July, and this needs to be met in order to apply to the UK Foundation Programme. The eligibility criteria involve having a valid medical degree approved by GMC. So that's I think that's all of us applying. Expect to obtain GMC provisional registration with a license to practice, written approval of their medical school dean, and the proof of English language proficiency. If you want more information, there's a lot of information on the UK Foundation Programme website. And I think if this is something that you are interested in, definitely read up beforehand, because you do need to prepare for applying to see if you meet the criteria to actually apply. And this is a sort of overview of the timeline, the IELTS, the assessments, and etc. But definitely refer to the UK Foundation Programme for this if you're interested. So how did I get my job? I actually, like I said, when we finished med school, I think we're all sort of like, okay, we need to start working, you apply. And in my case, I kept applying to jobs via track and NHS, but it was just a vicious cycle of you don't have NHS experience, And someone who I was essentially competing against, another international medical graduate or another doctor who maybe had already worked in the NHS, had more experience than me in the NHS, so they would get the job over me. So I was like, okay, what do I do next? How do I get a job? I then got in contact with a consultant at Royal Papworth Hospital, and I did 2 weeks as a clinical observer. This was before August, so it's around July time, so before the I guess year starts, academic year. And after I did my 2 weeks, so he was able to observe me. I was very involved during my stay. And then I asked, look, I'm looking for a job. I'm finding it difficult. Are there any vacancies? And there was a vacancy available for respiratory medicine. Initially, it was a 4-month contract, and I was able to sort of bring it to a year. And I spoke to HR and asked them if I could rotate elsewhere. And at the time, there was nowhere else to rotate at Papworth. But because they have links with other hospitals in the region, I was able then to rotate to West Suffolk Hospital. And it was, so I had done a whole F1 year in respiratory medicine, surgery, and COVID on the COVID ward. So I was actually able to rotate, and this was all started with the clinical observership. And I do feel like I want to stress this, that and I don't want to scare everyone, but I do want to stress that it is becoming increasingly difficult to get a job purely because they really want NHS experience. And I think my advice would be, especially in your 5th and 6th year, clinical years, 4th, 5th, 6th year, try and get attachments in the NHS, as many as you can, as much exposure as you can, so that when you do apply, you can use that and say, okay, I may have not worked for the NHS like a contract job, but I have shadowed, I have been on the ward rounds, I know what ward rounds are like, I know how jobs are done, I've seen it, I've been part of it. I may have not prescribed, I may have not treated patients, but I have seen this, and I think that would be valuable. So that would definitely be something I would stress to those still in medical school, even those who have graduated. If you can get a clinical observer, I would recommend, if you're finding it difficult to get a job, obviously. I'll speak a little bit about the CREST form. So the CREST form stands for Certificate of Readiness to Enter Specialty Training. This form essentially enables you to apply for specialty training and demonstrate that you have foundation level competencies. The person signing your request form must be a consultant who's worked with you for at least 3 months in the last 3.5 years. Initially, before getting my crest form signed, I was a little bit scared. I was like, how, who am I going to ask to sign this for me? But I think if when you're working on the wards and you're with a consultant every day, you form that relationship, you form that trust. They get to see how you work, and although they might not necessarily see all the aspects of the crest form, they also speak with other colleagues. They know how you are as a doctor, so it won't be difficult signing it. My only advice would be to, you know, ensure that the consultant that you're working with, obviously you have a good relationship with them, but also they are aware that this is something that you need to sign by a certain point, so that you don't leave it last minute, and they're aware of this. The crest form, so the new crest form has come out for 2024, which is now 1 page. Before it used to be 5 pages or something like that, but now thankfully it's just 1 page. So it should be a little bit easier to get it signed. And so what would my advice be? Like I mentioned earlier, do as many clinical attachments, observerships as possible in the NHS whilst you're still in med school. This is again to improve your chance of getting a job and to show them that you do have NHS experience, although it might not be working as a doctor in the NHS. It's, you've seen doctors work in the NHS. So I think you could use this for your supporting information, and it'll be valuable. So every time you apply to whatever job, so every time you apply to trust jobs on the track website, they'll always ask you about leadership skills, management and teaching skills. And I think there's actually a lot of things you can think about that you do in med school. So any international days that you've had to arrange, I would personally put that in management. If you've been a president of a society, it's leadership. And also if you've been teaching students, you can put that in teaching skills. I think you should use everything, any skill you've gained throughout med school as evidence. Don't feel like you haven't done enough. I'm sure you just need to sit down and think about the things you've done through med school. And then prepare in advance. So like it was mentioned earlier, the GMC registration, prepare the documents in advance because it will take some time. Even the UK Foundation program, you need to make sure that you are actually eligible to apply for it. So prepare before it's too late, because I know some colleagues who have wanted to apply, for example, for the F2 standalone, but they were too late to apply because of the deadline. So find the timeline of things, and work towards your CV. So say, for example, you have now completed med school, you're working, and now you want to enter specialty training. So you want to tailor it towards what you want to apply to. So now I want to apply to anesthetics. So I'm ensuring I'm attending courses like airway courses. I've done a taster week, which is essentially a couple of days in the specialty, so anesthetics. I was in theatres and I was just there for a week with the doctors, seeing what it's like. And that shows commitment and dedication to the specialty. And this can all go towards your application when you do apply. And one very, very useful website is Road to the UK. They've got a lot of information of essentially, like I said, the different routes to the NHS and interview prep, everything that you need to work as a doctor and to be successful in job application. And that's it. If you have any questions,